So predictive biomarkers in non-small cell lung cancer is a continued debate. The busy oncologist is looking for the need to not have to look at additional testing. So we've got a variety of things to be considered, and really the more we look, maybe a little more confusing it is right now to some folks. But we've got PD or PD-L1 overexpression with immunohistochemical staining. So a fairly easy test to do. Then we've got next generation sequencing. Helps us find those patients that have got the mutation that would be a driver. So the mutation sensitive to EGFR inhibitors, the ALK overexpression and the like. So when we look at the tests that are available, we can begin with PD-L1 overexpression. Fairly straightforward, immunohistochemical stain to be obtained on patients. All the usual issues of greater than 1%, greater than 50%, where do you really make the cuts? And then go to the extreme of next generation sequencing. We get a lot of data from NGS. We're beginning to understand the tumor mutational burden. There certainly is a range of effect with those patients that have higher tumor mutational burden for immunotherapy. I find that to be very intriguing. The trials all seem to point in that direction, that that's a prognostic factor for whether you're likely to respond or a predictive factor for benefiting from the treatment. So really, really interesting information there. As much as we'd like to sort of be told what exact patient to treat, I think right now for the non-small cell lung cancer patient, I think we want to know the PD-L1 overexpression, and I think all relapsed recurrent non-small cell lung cancer patients should get next generation sequencing. We now have FDA approved tests, we've got CMS reimbursement. There's not an excuse to incorporate that into your patient's design. The trial results are a little bit all over the place, but I think the trend is that those patients that overexpress get greater benefit. The patients that have higher TMB obtain greater benefit. And then lastly, you don't want to miss that patient that has a genetic aberration, that has got ALK amplification or the T790M mutation, where really some of these new therapies can change their life dramatically.